very much based on public-private partnerships, local community needs, and it's not just all about education, it's about the full environment of child development supports. It's really an efficient way for the taxpayers to get the most out of their money. Great Start is now being run by the new governor of Michigan after a lot of years of developing it. It's a different system. It's really more of an education system than it is a total community and health support system. So any way that works for you is fine, but you can follow these models and just get them moving. The other is to put your mouth where your money is. And I think that as business leaders, if you invest in early childhood development, then you have to become an advocate for it. And you have to be careful about the other things that you advocate for. So, for example, if you're looking at a local budget or a state budget and you have money invested in early childhood development and you say, I don't want to have a tax increase or there needs to be a 2% across the board cut, you're basically betting against the horse that you bet on. And what you have to do is look at your total behaviors and your lobbying and your interactions and how you're dealing with government and regulation and taxation. I've got money on early childhood development as economic development, so therefore if there needs to be some cutting, this program needs to be saved. By the same token, if you're a foundation and you've invested in early childhood development and you think you're going to get results in community building and doing this in 2 years, that's not going to happen. If you put your money down on it, you're in for about 5 years at least to build a comprehensive system and then to see what those results are when those kids hit K through 12. And you look at that data and then you adjust. So, and if you want to know more about this, and he has a number of lectures on the ROI, and you can look at all the economic data and everything. There's a great website that we developed for him called heckmanequation.org. There's videos on there where he talks about skills and abilities gaps. If you need to go out and convince other business leaders or other foundations that this is something that you should be doing, you can show them these videos. You can use all of these materials. You can download them. They're yours for free. So with that, thank you, and I'd be happy to entertain any questions. The reason why Washington doesn't get it is because political power, and it's not about really doing anything. That's the honest answer. I was a Democratic political consultant for 27 years. I got into it because I thought I could affect social change and do well for people doing it. And I found that I couldn't, and I got out of Washington. There's a lot of people on the top and on the bottom that are supporting that or shouldn't be, and it's a big game, and they're not getting it. They'll get it from you. I always tell people that when I started my career in politics, you went to somebody and you said, okay, what do you want to run on? And they would tell you. They would sit down and tell you what their position was and what they wanted to do and why. And they were very thoughtful people. And then you would go out and do a poll, and you'd say, well, I don't agree with you about that. And they'd say, well, I don't care. And then all of a sudden, I started going around, we started talking to people, and we'd say, well, you know, what's your position? And they'd say, well, that's why I hired you. And it's like, no, you hired me to help you communicate your position to people and see whether or not they want to vote for you. Is that all that polling, all politics is poll-driven now. And so what happens is if there is not a groundswell in communities such as yours, politicians will not get it. But if you go to those politicians and say, you know what, the central part of our economic development is early childhood education, you need to link it to K through 12, and you need to work on cognitive and emotional skills, and you hear that from enough people who give them money and talk to them all the time and people they trust, they will get it. So that's really why we've been going around and talking to communities, because we talk to Washington all the time. And they say, yeah, but until somebody in my district tells me they get it, I'm not getting it. Head Start is really important. It's a good program. If you have a good program here, you know, please continue to support it. Early Head, for example, right now, allowing them to use more Title I funding to put into Head Start and Early Head Start. For some kids and for some families, you know, starting at 3 and 4 is too late. And you know, you're even having Head Start programs having to do remediation. And if we can get in early, particularly with young parents, and do that kind of interaction with parents, when they have kids again, they know what to do. So those programs are critical links. A lot of communities don't believe in government or don't want to have a lot of government. So we're looking at programs that put together local foundation money with business development money, and they bring in a private group. There's a great program out of Omaha that Warren Buffett supports called Educare is built on the Perry Preschool model. And that's really a public-private sort of thing, and the middle-class, affluent families also send their kids to the centers, and then the people who can't pay are subsidized. Health really has to be an input, and you know, our two biggest social expenditures in the United States, in every community, every state, are health and education. Like, you know, the reason why health and education gets cut in state budgets is because it's usually the biggest things in state budgets. If you can somehow make them work together better in early childhood development and use early childhood development to put those things together, it would be very helpful and actually very advantageous to taxpayers. I don't know how people feel about healthcare reform, but one of the things in healthcare reform are community partnerships that are actually supposed to be doing this, and that would actually save people a lot of money. So if they're going to keep anything in healthcare reform, they should really keep those partnerships. This idea, this concept, is just now beginning to have traction. There have been groups out there saying this for 20 years. That's about how long it takes to get traction. So now it has traction and people are looking at it. The problem is that within K through 12 education, there have been so many successive reform movements, and then like punitive reform movements mixed in with very well-intentioned people who didn't know what they were doing. So the system is buffeted from the outside. We're looking to educators to tell us how best to do it. Everybody's an expert from the outside, telling them what to do. And because of that, they become very battle-hardened, and they don't want to move. When I go out and talk to superintendents, it's very hard for them to move within certain areas because they're kind of straitjacketed federally and whatever state requirements, and then it's very difficult to move communities. This is like a business getting a new piece of data. Like a lot of times I'll walk into a business with a McKinsey or a Bain Capital, and we'll sit down and we'll say, you know what, if you go in this direction, you're going to make a whole load of money. And they go, wow. And they move. This is like somebody coming in with new data, and you're dealing with governments and communities and all sorts of things back and forth, and it's hard for them to turn the battleship. Some people are now looking at K through 3, and some people are now pushing this idea of 0 to K through 3, and looking at that, or taking K through 3 and splitting it off from the K through 12 system in some way to look at those linkages in early development. But those are the people who are on the cutting edge of it, and there isn't a lot of support within the communities.